This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. LaFredo, and this week my guest is my wife,
Lyanna LaFredo.
Hey, Dr. LaFredo, welcome.
Hello.
So welcome back. It occurs to me, did you ever see the that old TV show Hollywood Squares?
Yes.
You did?
Yeah.
I'm surprised you did.
Yeah.
That might have been before your time in this country.
Well, it aired in the Philippines.
Oh, is that right?
So
Okay.
I think it was one of my favorite shows to watch.
All right. So I think you are the center square of Focus on Your Health. You're the one who's just always around.
Okay.
And you know, the other squares, they come and go, but like the center square is the one who's probably doesn't have a lot of other acting gigs lined up.
Mm-hmm.
So
yeah.
he or she sticks around for longer. And you're the center square because I know where to find you, and some of your colleagues are more difficult for me to find.
Mm-hmm.
So you're back, and this week, and welcome. So this week we're talking about sleep. That's dangerous to talk about on the radio, the power of suggestion being what it is. I don't want to put the audience out, but we're going to talk about sleep.
Yeah. It's one of the more common concerns of parents. Seems like every day there is a question about sleep. How long their kids should sleep, questions about how to get their children to sleep through the night.
Of course, kids are your specialty, but sleep is important for everyone.
Yeah.
And so how much sleep should adults get to begin with?
Well, 7 or 8 hours. And actually, the sleep is really important for people of all ages. The American Heart Association even said that people who get less than 6 hours of sleep a night tend to have poorer health. It will affect your longevity.
Right.
You're more at risk for heart disease. So get at least 6 hours of sleep a night.
At least 6 for adults. And then the numbers change. What about for people like seniors, people who are older? Do they sleep longer or less?
I think they sleep. I mean,
their hours change, right?
Their hours change. They tend to wake up earlier,
right?
And I think they sleep less.
Okay,
but I'm not a geriatric expert.
But you are more or less expert in the little ones. And how long do babies have to sleep and little kids? And does that change with their different stages of development?
Yes. Infants and newborns, parents know that they sleep all the time, almost all the time.
They're like cats.
They're like cats, yes. And then as they get older, their hours of being awake tend to get longer. So different age ranges, there are different recommendations for the hours of sleep that kids get. And it's not necessarily the amount of sleep that you get at night, but like the total amount of sleep you get over the course of 24 hours. Because younger kids still take naps, so you have to take that into account. So infants, they tend to sleep every 3 to 4 hour stretches. Then they would wake up to eat. And then they would go back to sleep.
They're kind of like college students on the weekends.
Yeah. And then when they're about a month old, you expect them to be awake longer, at least an hour. And then infants, and then as they get older, they tend to start sleeping longer and then getting like shorter naps in the daytime. From 1 to 3 years of age, kids still need about 12 to 14 hours of sleep.
Wow.
And then between 3 and 5 years of age, they still need about 11 to 13 hours of sleep.
Wow.
And then from 5 to 10 years, they still need about 10 to 11 hours of sleep.
So if you're 10 years old, what's your bedtime probably?
Bedtime, well, it depends.
You have to get up early for school, right?
Yeah, so parents would have to take that into account. Like, what time does the kid have to wake up in the morning to get ready for school?
School starts at what, about 7:30, 7 o'clock, something like that? It's been a while for me.
About, or 8.
8.
7:30, or yeah.
You figure with the commute, you're probably getting up around 6 or 6:30?
Most of the kids wake up around 6.
6
even,
o'clock.
Yeah, even 5.
Oh.
Because if their bus picks them up early, then they have to wake up early.
All right. So if you're getting up at 5 and you need 10 hours of sleep, you're going to be going. I wasn't a math major. You're going to be going to bed at 7 p.m. No kids do that.
Yeah, I mean, kids do that.
10-year-olds?
Well,
come on.
I have a few patients who sleep at 7.
But okay, but based on what you're saying, then my feeling is that probably if that's really what you need as a 10-year-old, for example, then the vast majority of 10-year-olds must be way below that, right? They must be under-rested.
Yeah.
And so this begins, if it's like that when you're a kid, I mean, I get this feeling that it begins as a kid and then it just never stops, right? We just never get enough rest.
Yeah, I think that's one of the problems now. Or maybe it's been a problem for a while.
I mean, when you say now, I mean, I don't know how much it's changed. I know when I was 10, I wasn't going to bed at 7 p.m.
What time did you have to get up in the morning? Do you remember?
No. I would probably remember if I got more sleep.
I think knowing now that that's the recommendation, I don't think I got that many hours of sleep. For me, school started at 7.
Yeah. So we're talking about rest and we're talking about education. We're talking about the lack of rest and trying to catch up. And it made me think, I'm wandering off topic a little bit, but it made me think about my second year of college. I talk about this a little bit. I have talked about it a little bit on the show. And I was a music major. And probably to the average listener, that's like, oh, a music major? What is that? Oh, that's cush. That's art school. Oh, buddy, I'll tell you what. I never slept. I worked just endless days and nights, and I got a couple of hours of sleep per day. And a really bad coincidence was at that time at music school, I was taking this world history class, and there was this quote that came up. The instructor told us about it as we were studying Napoleon. And somebody asked Napoleon, how many hours of sleep should a person get in a night? And Napoleon said, 6 for a man, 7 for a woman, 8 for a fool. Now, I heard this just at that right time in my life, and I was like, it totally resonated with me, right? Oh my gosh. I was a wreck from lack of sleep. And the irony is, as an instrumental music student, you're there trying to get more coordinated. Mm-hmm. And for all my lack of sleep, I couldn't keep, like if I went to the cafeteria and got a glass of orange juice, I couldn't keep it upright. I would spill drinks, a few times a week, and I would stumble on the staircase because I just was kind of coming apart from lack of rest.
Mm-hmm. And that, I could see that. And that's one of the side effects of lack of sleep in children. They tend to be hyperactive. So instead of being drowsy, they tend to be hyperactive. And also it affects their attention span. So a child who is not getting enough sleep can be, could be diagnosed or could be seen by the suspected of having ADHD when in fact he's just not getting enough sleep.
Yeah.
Yeah. So sleep is really important. There are a lot of effects of not getting enough sleep.
Lack of coordination, lack of concentration.
Mm-hmm. Yeah.
I would think impulsivity falls in there somewhere too. I don't know.
Mm-hmm. Yeah.
What I do know, of course, I'm no neuroscientist, but what I do know is that when you rest, it is a time when the brain goes under repair, right? You kind of like, help me out.
Yeah, it's when the brain gets rid of all the toxins that it collects throughout the day, like the waste products.
Yeah.
Like every cell as it functions collects waste products, and then you get rid of it. And when you're sleeping, that's when the brain does its work.
Yeah.
Basically, the housekeeping. That's when the brain does its housekeeping. So if you're not getting enough sleep, then
so you picture me at music school. I had a brain full of waste products.
Yeah. Mm-hmm.
Boy. All right. So let's return to younger kids now. We're saying 10 years old and they need 10, 11 hours of sleep.
Yeah.
Something like that. Oh my gosh. And I'm thinking, here's something else I don't know. I know pretty much everybody in the world has a computer and a cell phone. And I mean, you probably have 9, 10-year-olds who have cell phones and are connected, right?
Yeah. I have a few.
Yeah.
And teenagers especially, they still need about 8.5 to 9.5 hours of sleep a night.
Okay.
And there are studies recently showing that a lot of kids nowadays are not getting enough sleep because of the electronic devices.
Yeah, that's what I'm thinking.
They tend to sleep with their phones beside them, and they would get text messages in the middle of the night, or they could check their social media. They could check Facebook.
That's Shiver.
Oh.
He does that sometimes when I'm trying to record. That's the studio cat, by the way. He wanted to be on the radio. Mm-hmm. All right.
And that's really leading to a lot of sleep-deprived teenagers.
Yeah, I think they're not alone in that. It's funny, like, we get concerned about sleep-deprived teenagers, but sleep-deprived adults are just sort of like, well, that's how it is. That's what it means to be an adult, right? But I think there are probably a lot of adults who are living that exact same way.
Yeah, and I think it's a habit for a lot of people to watch TV or check their devices before they go to bed.
Yeah.
And that's really not, it's not conducive to sleeping. It just activates the brain even more. So it makes it harder for someone to go to sleep.
Especially, I'm just thinking, especially if you get some news. Young people's lives are so full of drama. It's like, everything seems like big news. I'm thinking about I'm thinking about teenage girls in particular, but like everything seems like big news and it never stops. Mm-hmm. And when we were kids, my sister was on the house telephone all the time. But now that's not really necessary. Mm-hmm. That you have your phone right there on the bedside table and it's keeping you up all night.
Yeah. So this is an advice to parents to, have their kids check their phones in for the night.
Check them,
Yeah.
How does that work? Probably by the time you're 17 or 18, it's not happening.
Yeah. But I've had a few parents who've, if they find that their child isn't getting enough sleep at night, then they start doing that because they realize that it's because of their devices. And so having the child check their phones in for the night really helps with getting their child the sleep that they need.
Yeah, I've heard about kids who become addicted to video games and can't separate from this, to the point where some kids they wear diapers. They wear adult diapers.
I've read news about that
because it's so. I mean, they get caught up in the game, and there are other players. It's a live contest, and it sounds like I don't know. It's not my world, right? But it's so exciting to them, and they have so much. They put so much stock in it that to get up and go to the bathroom, it would be a terrible thing. So they play these games with diapers on.
Yeah.
And I'm just thinking, there's something about electronic devices, and it's because of the instantaneous nature of that communication. It makes it very hard to separate when you get swept up into that. Mm-hmm. Some of these are social changes that have come up, but the human body, the human mind is not going to change. I mean, it does change, I know, right?
It does change, but not as fast as the technology, not as fast as technology has changed. So we're not really
sleep.
Yeah, our bodies still need sleep, and the human body changes because of evolution, and that takes thousands of years.
Yeah.
And the way technology is now, it's
a new generation of phone every year or two.
Yeah.
Huh. So I mean, you could. In a way, I think we're going through these growing pains now. But, I hear myself say that. I don't know if we're ever going to reset where we say, okay, I'm going to have a healthy relationship with my phone or I don't know.
They will always be catching up. It's break time on Focus on Your Health. We'll be back in just a moment with more from me, Dr. Lyanna LaFredo. Stick around.
There are code breakers with lines well tied, traces sweeping out.
And welcome back to Focus on Your Health. I'm TG LaFredo, and this week my guest is Dr. Lyanna LaFredo. She's a pediatrician at Joshua Tree Pediatrics. So let's bring this back to sleep then. One question I think you hear often is, my little kid, my little guy just won't sleep at night.
Mm-hmm.
And parents are desperate for some rest themselves.
Mm-hmm.
Well, do you just have to wait that out?
You have to wait it out, and also you have to not start habits. Kids normally wake up anyway because the sleep cycle is they run about 90 minutes. And then after they go through a 90-minute cycle, they could go to the surface and kind of get to a cycle of light sleep,
Right.
where they'd wake up. But most kids learn how to, even when they wake up, they just, soothe themselves back to sleep.
Okay.
And some kids don't learn how to do that. And so they wake up, and then the parents would have to go there and soothe the child and have the child go to sleep. And then so the child doesn't learn, or the baby doesn't learn how to soothe himself or herself, and has to rely on a parent to help.
Well, I know there's kind of an old-fashioned idea about, this is a little
Letting
baby,
them
let him cry it out.
Yeah, the cry it out method is...
Is there anything to it, or is that a bad thing?
It actually is the most effective, research. A lot of research has shown that it's the most effective way of having the child sleep through the night. But it's also more difficult for parents to follow, because who would want to, most parents wouldn't want to, or couldn't do that. They couldn't just let their kid cry out.
And the bonding, I don't know, right? I mean, that's the rationale I've heard. No, you can't let the kid cry it out because there's this bonding that goes on, and he knows that you're meeting his needs, and he's secure. And
yeah, but that's up to a certain point.
Mm-hmm.
After around about 6 months, you've...
Tell him, toughen up, kid.
Well, you have to start having them learn to sleep through the night.
Yeah.
You've already built a relationship with a child, and now it's just a matter of training or helping the child learn to soothe himself or herself through the night. Research has shown that there's really no difference in the kid's emotional state,
Okay.
whether the parents let them cry out through the night or whether they respond to them right away when they're crying at night. But there is a difference in how the stress level of the parents.
Yeah, okay.
Yeah.
I can see that.
So
based on that, do you ever have parents who come in and say, I'm convinced that the right answer is some sort of sleep aid for this child?
there are some parents who do ask for sleep aids for their children. And before I recommend any sleep aids, I ask about what their habits are
the
first.
whole social environment.
Yeah, what are their routines before bedtime? Because that has a lot to do with it. Like the kids don't just turn off and get ready for bed. They need to
kind of wind down a little bit.
And so you need to establish sleep routines early on. And that's why it's a signal to them, like when they have this, this ritual, whether it's like a bath and then a bedtime story, it's a signal for them. Their body kind of realizes that, okay, it's time for me to wind down.
Yeah.
But it's initially when you start establishing these routines, it's going to be difficult, of course. But there are some kids who are legitimately have problems going to sleep. And that's, and I ask about what the parents, whether the parents have problems with sleep as well, because it could be genetic. Melatonin is a safe sleep aid. Like if they have like medical conditions like autism, they really have a hard time with falling asleep. And so melatonin can help. It's a natural hormone that the body or our brain produces throughout the day. Like sunlight exposure to sunlight activates it and helps the brain produce enough melatonin so that at a certain point, at bedtime, you have enough melatonin produced by your body or produced by your brain to help you go to sleep. And then there are some people who just don't produce melatonin, and so they need melatonin to go to sleep.
Okay.
Yeah.
So these are the legitimate, these are the people, is that a prescription or is that just?
Now you can get it over the counter.
Yeah. These are the people who need sleep aids.
If they, yeah.
But I'm kind of getting the sense that it's not something you recommend very often.
No.
It's just for those special cases.
Yeah. Some of the sleep aids, too, will have an opposite effect on children. Like, how Benadryl, a lot of adults take Benadryl to help make it because they make them sleepy.
Yeah.
But a lot of kids, when they're giving Benadryl, they just get more hyper.
Why is that?
Because of how their nervous systems are.
Yeah.
They're still sympathetic. They're just, that's their natural.
They just go.
Yeah, that's their natural state. One other question that parents ask me is, kids waking up in the middle of the night and how they can have the baby go back to sleep. Usually they have to give them a bottle, but then when they're around 9 months, 9 months old, they don't really need bottles anymore. So if they give them a bottle, it becomes a habit that they'll keep asking for it. So just go in and help them go back to sleep without a bottle, and then until they soothe themselves back to sleep. Right around 9 months of age, even babies who've been sleeping through the night start waking up in the middle of the night, and that's because that's when they start getting separation anxiety. So parents will say, oh, even in the daytime you can't leave the child, and because they have separation anxiety, and the nighttime awakening is a manifestation of that, because they wake up in the middle of the night and they don't see their parents, and so they cry out. And so it's a way of, so when the child does that, the parents will just have to go in and say, okay, go back to sleep, I'm here.
It's perfectly normal. Happens with every kid, essentially.
Yeah, almost. Yeah. Almost every baby, yeah. And then you might have to wait a little bit longer to respond to the child. See if they'll go back, if he or she will go back to sleep on his own.
Talk about night terrors.
Mm-hmm.
Nightmares and night terrors.
Night terrors are usually the child wakes up in the middle of the night crying and does not really, like, even if the parents ask the child, okay, what's going on? Why are you crying? The child does not respond. But then we'll just stop crying and then go back to sleep. And then when you ask the child in the daytime, you woke up last night, do you remember? And the child does not remember.
It's a kind of sleep disorder, yeah?
Yeah, but it's also natural. It's natural for a child to have night terrors.
Okay.
And they usually outgrow it by about 5. And then nightmares, on the other hand, are, where the child remembers, like there's really, oh, I had a bad dream, it's about this. And the child will remember, or often would remember it in the daytime, like what they dreamed about.
And a certain amount of that is perfectly normal and not really worthy of a consultation with the physician. Is that right?
Yeah. Yeah. And a lot of times when I ask, okay, you had, for children who have nightmares, and I ask what they're, what do they do before they go to bed? And usually they watch
World War II documentaries.
Yeah, they watch some scary, or not even, I guess they're for adults, they don't think that they're scary, but for kids,
everything's scary.
So it could be, there's something about, they watched, and then, I have like 3 or 4 year olds say, they watched this scary horror movie. Yeah. I said, that's why you have nightmares.
I think I've solved the problem.
Yeah.
That's Dr. Lyanna LaFredo. She's a pediatrician at Joshua Tree Pediatrics. You can reach her office at 928-681-8706. That's 681-8706. Dr. LaFredo, my favorite center square, thank you so much for joining me.
You're welcome.
And that's the show. I'm TG LaFredo. Thanks so much for listening. If you'd like to write to me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health. foyhradio@gmail.com. We'll catch you next week.
I keep forgetting the guy because you keep saying like the center square. Isn't that, what's his name? Gilbert Gottfried.